people in this room that represent South Africa. But before we speak about launching into health and the future, we must honor the foundation on where we stand and where we began. Regenesis Education was founded on a bold and transformative philosophy. It began with one man, one thought, one philosophy. A vision, actually, to make the world a better place through education. Dr. Marcos Sharavanya believed education in South Africa and across the world needed to be revolutionary. Not just academic, not theoretical, but holistic. Our tagline is who we are. He believed education must awaken the potential of the whole human being. So when we talk about awakening potential, we don't merely talk about IQ that our healthcare sector possesses a hell of a lot of. But we talk about emotional quotient. How do we manage self in order to lead others? We talk about spiritual quotient, and not religion, but fundamentally, when I strip out COO and Indrani Jolene Reddy, who am I as a person? Who am I? And what is my purpose? And how do I make the world a better place? SQ. Then we talk about physical quotient. So if I line up Regenesis here, you'll see a whole lot of, physical fit people. And so physical quotient is really about this vehicle. To get my message out in the world, to make an impact, this vehicle needs to carry me. So Regenesis has a gym called Healthy. We conduct classes in high-intensive training, running, hiking clubs, tennis clubs, running clubs, yoga, fitness for the mind in meditation and mindfulness. And then we move on to financial quotient. We have Regenesis Investment Fund that teaches our students, faculty, and our alumni about investments and trading and how to make money while you pay your time. This is holistic. So this vision was about taking a powerful ideology into a partnership. Within 6 months of the idea, Dr. Penny Law, our co-founder, joined, and Penny helped shape the academic rigor, the governance, and ethics that allowed this philosophy to grow and manifest. A year later, Dr. William Vivian joined within the first year to help scale what was no longer simply an idea and a business, but a movement that is now thriving. So from those early beginnings 28 years ago, of almost 30 and one 30-year-old who set out to redefine education. How many 30-year-olds in the room today? Imagine redefining an entire sector at 30. Powerful. Powerful indeed in thought, but even more impactful when I can stand here 28 years later to say that Regenesis has now expanded into 12 countries across the globe. From South Africa, where it first began, to Nigeria, India, Botswana, Zimbabwe, Zambia, Tanzania, Uganda, Namibia, Mauritius, I hope I'm not leaving anyone out, Croatia. So a movement that spanned not just across the continent, but with a vision to make the world a better place through conscious leadership. So today, we stand strong with 15,000 students, 500,000 alumni, more than 1,000 corporate clients, the likes of Mercedes, Momentum, Suzuki, Eskom, Access Bank, African Bank, Samsung. And our vision has penetrated not just companies and countries, but boardrooms, government departments, entrepreneurial ventures, policy, platforms, systems thinking, and classrooms across the globe. Our growth has been deliberate, strategic. responsive to the sectors that will shape destiny across the globe, penetrating every industry through conscious leadership. From our School of Business Management to our School of Public Management, the School of Technology, School of Law, School of Education, School of Entrepreneurship, today's School of Healthcare, and tomorrow, quite soon, our School of AI. We didn't just merely participate in the sectors, our intention was to disrupt it for the upliftment of society and to give access to students across the globe. Because at Regenesis, we understand something very, very fundamental. When you transform leaders, you transform organizations. When you transform organizations, you transform communities. And when you transform communities and societies, you transform the world. So we're audacious at times to believe that we can make the world a better place because we exist. And so we hope that you join us today as conscious leaders, not just to support healthcare, but to support our movement. So tonight we extend this mission into one of the most urgent and defining sectors, healthcare. Healthcare is more than just about medicine. It is more than just about governance and sustainability and innovation. Healthcare too has joined the digital transformation. And so how do we take what has always existed, policy alignment and sustainability, but digitally transform it to not just treat the sick, the needy, and the helpless, but to start a revolution on well-being and a healthy nation, to take charge of our own lives, and through our leaders, inspire healthcare to change the way it serves the needs of people globally. Tonight, we launch the School of Health, not as just expansion, not as just another school, but an expansion for greater impact. Because it's not just about being fashionable to have another school added, but it is necessary. We believe that this is necessary for resilience, and we believe that we've grown our sector so much that it is a necessity for the dignity of people to support healthcare through education. The School of Healthcare will not merely produce graduates. It will produce leaders that are capable of strengthening hospitals, shaping policy, driving innovation, and ensuring that service delivery services all. Ladies and gentlemen, history has never been defined by millions. It's a few good people that stand up against the norm and shift. So today, this is one of those moments in history that started off with one man, one thought, one ideology that has spread to 12 countries, a staffing of 1,500 people and more. And I extend that community to each one of you today. Not just you, but you and the people you represent with us today. So on behalf of Regenesis Education, it is indeed a privilege and an honor to welcome you to the official launch of our School of Health. May this evening mark the beginning of a new chapter in this new year. We've been told that this is the year of the fiery horse. And I don't think there could have been a better year to launch healthcare. Not only for our institution, but for healthcare leadership in South Africa. I want to introduce you now to our head of school. At the heart of every great school, there must be great leaders. People who are not just technically astute, but are value-aligned to an institute. And so it's my privilege to introduce someone who embodies both scholarship and purpose that's aligned to Regenesis. Dr. Rowan Govender holds a PhD in clinical medicine and has walked the full spectrum of academia, researcher, and healthcare leader in his healthcare journey. He understands the science of medicine, the discipline of research, and the realities faced in the healthcare systems. But most importantly, Dr. Rowan, we love that you align so deeply with the Regenesis philosophy. And that leadership in health is one that speaks ethics, that will disrupt healthcare to make sure there's accessible, conscious, and transformation occurring in our classrooms. Not only does he join us with his credentials, but with this conviction. So please put your hands together to welcome Dr. Rowan Govender.
Thank you, Indranee. Healthcare is no longer just a sector. It is the single greatest determinant of whether nations rise or fall. Every statistic in healthcare hides a human story: a mother, a child, a worker, a community waiting for leadership that works. With this in mind, good evening. It is an absolute pleasure to have you all here with us today as we launch the School of Health Sciences, a moment that represents vision, courage, and responsibility. Distinguished guests, honored dignitaries, co-founders, directors, colleagues, students, and friends, a warm welcome. We are deeply honored by the presence of the leaders who are shaping the future of higher education, health policy, science, innovation, and industry in South Africa. We are equally privileged to welcome the co-founders of Regenesis, our board of directors, executive leadership, academic, professional staff, industry collaborators, and every member of our broader Regenesis community. The school is built on your belief, your commitment, and your partnership. Tonight is not simply about launching a new school or academic unit. It is about launching a new model of healthcare leadership, one grounded in artificial intelligence, innovation, ethics, and system thinking. We are living in an era where machines can analyze scans in seconds, predictive systems can anticipate outbreaks, and digital platforms connect specialists to underserved communities instantly. In fact, here this evening, there are 2 AI-powered health machines on site offering free healthcare guidance, a live demonstration of how innovation can enhance access, extend expertise, and support decision-making in real time. Yet despite technological advancements, healthcare systems across the world remain strained. Inequality persists. Access remains uneven. Leadership gaps continue to widen. The question is not whether AI will transform healthcare. The question is, who will lead that transformation and how? The School of Health Sciences exists to answer just that. Our vision is to develop leaders who are clinically informed, technologically fluent, ethically grounded, and strategically capable. Leaders who understand that healthcare is not merely a service, it is a system. Health is not a silo. It is the foundation of national development, and systems require leaders who can integrate disciplines that have traditionally operated separately. The school will operate across multiple levels because transformation cannot occur through one pathway alone. We will deliver education across every level of healthcare, empowering frontline professionals with digital capabilities, equipping managers and executives to lead through complexity, and offering qualifications from certificates to postgraduate qualifications, and in time, medical degrees, all integrated and integrating clinical excellence, leadership, innovation, and technology. Because the future doctor must understand systems. The future nurse must understand data. The future executive must understand clinical realities. We are building bridges between healthcare and technology, between clinicians and administration, between innovation and regulation, between policy ambition and operational execution. AI is not the hero of the story. Leadership is. Artificial intelligence can process data, but it cannot build trust. It can optimize systems, but it cannot replace compassion. It can predict risk, but it cannot define values. That responsibility lies with us. Our commitment extends beyond the classroom. A central pillar, in fact, of our community engagement strategy is supporting the development of a health and wellness center in Orange Farm. The center is envisioned as a community-embedded facility focused on primary health care, preventative screening, chronic disease management, maternal and child support, digital consultations, and health education. We look forward to meaningful partnerships to bring the Orange Farm Health and Wellness Center to life as well. Because sustainable healthcare transformation requires collaboration, right? The most powerful innovation in healthcare will not simply be artificial intelligence alone. It will be integrated intelligence, human, technological, strategic, and moral intelligence all working together. The school will serve as a convener, a catalyst, and a collaborator. To our guests, we invite you not to only witness this launch, but to shape what follows. To our co-founders, our directors, staff, and our esteemed guests, thank you for believing in a vision that is ambitious, necessary, and extremely timely. To our future students, you are not enrolling for just a qualification. You are entering a movement. If we lead differently, ethically, strategically, and inclusively, we will not simply adapt to the future of healthcare, we will define it. Thank you.
Thank you very much, Dr. Rowan Govender. Your speech on stilettos like me. To try it the next time. So the next person also comes in on stilettos like me. I'm adjusting the mic for him as well. So our keynote speaker this evening is a leader very similar to how I described the Regenesis philosophy. When we speak about healthcare and systems and leadership in South Africa, we speak about stewardship. And we speak about institutions that don't merely operate within the system, but actively shape it. And as CEO of Netcare, Richard Friedland has played an absolutely defining role in advancing private healthcare, digital innovation, sustainability, and something that's very close to our heart, patient-centered excellence in South Africa. Under his leadership, Netcare has evolved beyond being a hospital group. Under his leadership, it has become a healthcare ecosystem, integrating governance, clinical excellence, community impact, and technology. He understands and brings into his team, let's call it his community, that healthcare is beyond just practicing about facilities. It is about partnerships, it's about systems, and it's about leadership that anticipates the future and reacts to it before others have even noticed it is going to happen. Because the launch of the School of Health at Regenesis is not happening in isolation, it has to be strengthened by partnerships like you. And so a strategic partnership for us is between Regenesis and Netcare, a partnership grounded in shared commitment, shared values, and shared vision to develop ethical, competent, future-ready healthcare leaders. This collaboration is really how we bridge not just our philosophy, but academia and industry. So together, Regenesis and Netcare signify something exceptionally powerful. Welcome on stage an exceptionally powerful leader, Dr. Richard Friedland.
Sanibonani, Dumelang, Tobela, Molweni, Goeienaand. Good evening, and for the one or two French speakers at the back there, bonsoir. Ladies and gentlemen, honored guests, esteemed colleagues, all protocol observed, thank you for the privilege of being able to address you this evening. And congratulations to you, sir, Marco, and your team for this extraordinary vision to create this new Faculty of Health at a time that is so needed in our country and in our history. And I'm going to ask everyone just to give a round of applause to the founder of Regenesis and this extraordinary vision. And I want to echo what Indarani and also what Rowan said. It cannot be more of the same antiquated 1970s approach to healthcare education. And even the healthcare that we teach in our medical faculties across the country. Not just here in South Africa, but around the world. And I say that, ladies and gentlemen, for one fundamental reason, and it might shock you. The healthcare we know today, whether in South Africa or the United States or in Europe or Southeast Asia, whether in the public or whether in the private sector, is fundamentally flawed and broken. Now, when I first told that to our board in 2018, they said, "Shh, don't tell the shareholders that." But that's the reality. And why am I telling you that? I'm telling you because if you look in real terms, in other words, stripping out inflation, healthcare costs have risen 700% in the last 50 years. Isn't that extraordinary? In the United States, private healthcare, in the UK with the famed NHS, in all countries around the world. But the question is, are we seeing the commensurate benefits of that 700% increase? And you can guess the answer, no. We're living a bit longer, almost a decade, about 7 to 8% longer. But we haven't begun to tackle all of the preventative diseases in our society. And so it should come as no shock to you that in South Africa, 60% of people die because of non-communicable preventable illnesses. Isn't that extraordinary? It's about 50% in the US that is lauded to have some of the best healthcare outcomes in the world next to Switzerland and Germany. And in the UK, it's just over 60%. There is a very large healthcare funder sitting here today that published data 2 years ago that showed that as South Africans, we're even getting sicker in terms of mental health, in terms of cancer, and in terms of chronic illnesses. And the really frightening aspect of the data they published was that we are seeing an exponential rise in this amongst our youth in the country. So, ladies and gentlemen and honored guests, what's gone wrong? Why has this actually happened? This exponential rise in costs and a very minuscule, anemic improvement in outcomes. There is a famous expert in longevity called Peter Attia. He's a pancreatic surgeon from Stanford. He's written a book called Outlive. And he says the problem with modern medicine, what he calls medicine 2.0, is we're very good at fast death. You have a heart attack, we'll call a plumber, a cardiologist, and they'll put a little tube in your artery. You fracture your ankle, we get hold of a carpenter, orthopedic surgeon, and we'll fix your leg. But in walks a diabetic patient or someone with hypertension, and we're pretty lousy at chronic illness. And that's one of the faults. The second is something more fundamental. that the healthcare system that we practice, whether in the private sector or the public sector globally, is fragmented structurally and internally in terms of the way we train people. What do I mean by that? You get pushed from pillar to post. You go see your GP, they take an x-ray, they take some bloods, they refer you to a specialist who says, no, I'm going to repeat that, I never got a copy of it. In the meanwhile, the patient knows nothing about it. It's a fragmented system. And ask any patient what's the matter with them or what happened in hospital, and they'll say, ask the doctor. I actually didn't understand the diagnosis. But our training is flawed as doctors, and I can speak from experience. We train people in single systems. And so you're sitting before your cardiologist or gynecologist, and you say, you know, I'm also feeling a bit low, maybe a bit depressed. Can you help me? No, go see a psychiatrist. Or you're in front of your dermatologist and you say, you know, my left ankle's hurting. No, that's an orthopod position. And you know, doctors are time urgent, so they've got 5 minutes or 10 minutes with you to make an entire diagnosis. And so healthcare is fragmented in the way we've trained our healthcare workers, even nurses. And I speak from experience. We run the largest nursing colleges in the country and also in the various faculties. But the most important reason why we have failed in healthcare, ladies and gentlemen, is that we ourselves as patients, as people, have been totally disempowered by a hierarchical and patriarchal society which is deeply entrenched in medicine. I'll give you an example. When I was a GP, I would often say to a patient, why did you have your tonsils removed? The doctor told me. Why did you have your leg removed? The doctor told me. Really? Is that the kind of health care where we disempower patients? And I think that's a global problem across the world. So what's the solution? What if we empowered patients, and by this I mean people, to become equal and active partners in their health care and to take co-responsibility for their outcomes and not to abrogate it to some doctor or specialist where they're merely a number? What if healthcare workers adopted the idea, or people, nothing about me without me? You know, we were probably the only healthcare organization, there might have been others, that didn't force people to have, and our nurses and our clinicians, to have the COVID vaccine. We informed them of the benefit. But at the end of the day, their bodies are their sanctuaries and they have ownership over them. It's their temples. And in many ways, we enshroud this philosophy, nothing about me without me. And this, colleagues, is exactly where digitization, the data that flows from it, and AI comes in to assist us in transforming healthcare. Not just in South Africa, but globally. And before I get into that, I want to read to you, it's so beautifully written, and it's written by Tom Laurie. He published it on January the 12th. Tom Laurie is probably one of the global thought leaders in healthcare. He was voted last year one of the top 20 minds in the practical application of AI in healthcare. And he came out about 3 or 4 weeks ago, perhaps a bit longer, to present to the Microsoft conference here in Johannesburg. And he published this article, and I'm only going to read the first part to you, but I'll make it available to Regenesis, and you can send it out because it really sums up what the issues are. This is the title of the article. Everyone says, and by the way, who is Tom Laurie? He was the former head of Google Health for 14 years, and he led most of those innovations before moving on into a different direction. Everyone says AI is disrupting healthcare. It's not. Consumers are. And I'm going to read just the opening 2 paragraphs because I think they are profound. There's a quiet but consequential misunderstanding happening in healthcare right now. Across boardrooms and conferences, conference stages, leaders talk about artificial intelligence as if it's the disruption to manage. The next great differentiator between healthcare organizations. Strategies are framed around AI adoption, governance, and maturity, as though intelligence itself is the holy grail. It isn't. The real disruption didn't arrive as a technology roadmap or a vendor memo. It walked through the front door, pulled out a phone, and sighed in frustration. Your competition isn't the healthcare system across town. It's the experience someone had with Amazon the night before. Healthcare today is no longer evaluated against healthcare. It's evaluated against the rest of a person's life. And in 2026, that life is increasingly intelligent, mobile, personalized, and relentlessly convenient. That is the shift many healthcare organizations still haven't fully internalized. And so, ladies and gentlemen, welcome to the era of the intelligent health consumer. And I urge you to read his articles. You can follow him on LinkedIn, probably on other social platforms. I'm not on them, but certainly on LinkedIn. And just read the wisdom that emanates from someone who's been deeply immersed in this journey and the genesis of AI and data. And that's Tom Laurie. So when I said this is exactly where digitization, data, and AI intersects with the future of healthcare, what do I mean? What I mean is the following. If we are to really empower patients, people, to be active participants and equal participants in their healthcare and to take co-responsibility, we need to give them their records. But can you imagine giving someone a hospital record that looks like an old yellow bank? Take this record home with you, and when you finish deciphering the doctor and nurse's handwriting in 6 months, come back to me. And so we cannot possibly hope the beginning of our own digital journey in Netcare. We didn't embrace Digitize the Month and a mega trend. We embraced it to begin of empowering patients with their records. But you know that's not enough, and we unintelligible. Can you imagine the following? Sir, you came into our hospital. You were diagnosed with an acute cholecystitis caused by a chronic cholelithiasis. We had to do an emergency laparoscopic cholecystectomy. We're sending you home with prophylactic antibiotics, and be careful of fatty foods. Is there anyone in the audience who's not a doctor who understands that? Of course not. But what happens if you put an LLM, a large language model, as we have developed one with Microsoft, over that and said to a patient, sir, you came into our hospital because of very severe pain and inflammation of your gallbladder caused by long-standing blockage due to gallstones. Because of the seriousness of the matter, we had to perform an emergency keyhole surgery to remove your gallbladder. And now, because you can no longer have bile salts that are produced from the gallbladder, please be careful of eating too many fatty foods. And by the way, we're just sending you home with some precautionary antibiotics. Spot the difference. That's how we've got to transform healthcare. It's not just about giving the records. It's about explaining them and giving people insight into them. But there's an enormous power that lies in data that you can't get from an ordinary handheld wired telephone, but you can certainly get from your mobile, and that's called data. And the problem is that when you digitize, suddenly you are drowning in a sea of data. All organizations go through this, and so did we. You become data rich, but insight poor. And so we've had to move into the next platform of saying, how do we invest in a data analytics platform that can understand and give us better insights into patient care into preventative care, and into improved safety. And that's an absolutely critical element. And I can tell you, in our own organization, we have used this to great advantage in patients. We've developed machine learning predictive models for patients in ICU, for instance, to prevent bloodstream infections. Bloodstream infections, or sepsis, as it's known in medical jargon, kills about 25 to 30% of patients in an ICU. It's catastrophic. But if you apply machine learning to all the data we're churning out, and we're churning out 55 gigabytes per day of this data, you can actually build an algorithm that can predict the onset of sepsis 10 to 12 hours before. We can save lives with that. By producing digital scripts, you can remove the errors in transcribing a doctor's handwriting. And the list goes on and on and on. But I want to talk to you about 3 things that happened in January this year. And I'll end with this in terms of data and innovation, that I believe have changed healthcare forever. The first was an announcement by the FDA that they are no longer going to certify wearable devices, the devices we use around our wrists in order to measure our vitals, providing those devices are not used for a medical diagnosis or for treatment purposes. And this is the most extraordinary transformative liberalization of healthcare. Because, ladies and gentlemen, the future of healthcare is wearable. It's untethered hospitals. If you had asked me in 2018, Richard, what represents nirvana here, or as I mentioned earlier, the holy grail of healthcare, that's giving a patient a record. But ladies and gentlemen, that's a Polaroid snapshot of what might have happened 3 weeks ago. But when you combine that record with live wearable data, you create something quite extraordinary. And so we're about to see this explosion of people wearing data, and it's incumbent on us to be able to integrate that into our record systems to give patients very rich information as to what they're doing. And I'm going to give you an example shortly. The second was probably one of the most fundamental papers written in Nature. Nature is the top scientific journal in the world, and if any of you, perhaps you are, Marco, but anyone out here is thinking of winning a Nobel Prize, not in peace, but in medicine, and in biology and in chemistry, it's best to try publish in Nature. But on the 6th of January this year, Nature published a study from a team of researchers at Stanford University. They analyzed the sleep pattern of 65,000 people, hundreds of millions of hours of sleep, and they developed an algorithm called Sleep FM. Now, what does this algorithm do? After one night's sleep, it is able to predict statistically accurately your chances as an individual of contracting or getting or falling ill to over 131 different illnesses. Wow. You know, I sent this out to my exco and I woke them up at about 3 in the morning because it is just so fundamental. And so we, together with our partners, developed an algorithm to take someone's wearable data and test it ourselves. This is anecdotal data. We took a young woman who was 31 years old with high cholesterol and 1 or 2 other issues and wearable data, and we put it into this algorithm, and we were able to take anecdotal data and statistically be able to prove to her, as a young, fit 31-year-old on no medication whatsoever, she had a 68% statistically valid probability of cardiovascular disease. Isn't that extraordinary? And that's the future of AI. And in January, we saw ChatGPT come out with their health app. We then saw Anthropic and Claude do the same. And then we saw Amazon. And so the world is exploding in terms of enabling what we call the intelligent consumer, or what Tom Laurie coined, the intelligent consumer. And that's the power of AI and of data and digitization, empowering patients with their records, but more importantly, giving them a very detailed, practical understanding of the importance of the so what. I want to end with this, colleagues and friends, that we can have all the data in the world. We can have the best AI, machine learnings, agentic AI, RAGs, tags, you name it. But if we can't treat patients and people with dignity, with respect, and with compassion, and that we don't understand as healthcare managers, as healthcare workers, even though we may be removed from the privilege of holding a patient's hand and maybe behind an Excel spreadsheet, but if we can't understand that that's an enormous privilege, then it doesn't matter how much data and AI and machine learning we have. And so my appeal today is where I want to start where I began. It's enough of the old, antiquated, archaic way of training our healthcare workers, of our doctors, of our pharmacists, of our nurses, and indeed, yes, Rowan, of our managers. You know, communication skills are absolutely appalling in healthcare. They're appalling amongst doctors, even nurses, and it got worse in COVID when we had a good excuse why we couldn't communicate. And I would love to be able to see that communication skills, the ability to actually listen and empathize and have compassion, is a major subject, just like biology is and anatomy is in our faculties. And I know with your vision, Marco, and that of your team and your stewardship, this faculty will be anything but archaic, traditional, but it will lead to something quite transformational. And we as Netcare feel honored to partner you into the future in really transforming healthcare in South Africa at a time of absolute crisis and need. And may you and your team be blessed with every success in not only transforming healthcare in South Africa, but indeed globally. I thank you, ladies and gentlemen.
Thank you, Mr. Richard Friedland. I'm sure you'd agree with me. You could listen, you'd probably want me off the stage to listen a lot more to Mr. Friedland. His pearls of wisdom, his experience in execution and translating it from high-fluted medical science and terminology, but possibly he uses Microsoft app as well, to tone it down for us this evening, it's just awe-inspiring. So thank you so much for spending this evening with us, but more than just spending this evening with us, thank you for the partnership that you are gifting as really the legs and the wings that will take Regenesis into the industry and disrupt and make the world a better place through healthcare service. Thank you very much. Ladies and gentlemen, you heard it from the healthcare and from industry. And so now let's go from industry to education. Education is the foundation on which a nation rises. It is the engine room for opportunity, innovation, and transformation. So tonight, we're very honored by a leader who's made it into this room from getting off another meeting before she takes off into the air and flies off to a different province, as someone who has devoted her career to shaping South Africa's higher education landscape, ensuring that our institutions are not just accessible, but world-class, relevant, and future-ready. The Deputy Minister of Higher Education and Training, Dr. Namusa Dube Nkube, has played a pivotal role in advancing policies that strengthen universities, support research, and cultivate the next generation of leaders. Please welcome me in a thunderous welcome of a true champion of education and transformation, Dr. Nomusa Dube Ngube.
Thank you very much, Program Director. Apologies for the late arrival. As you correctly say, I've just landed, and so is the job. Let me also acknowledge the Board of Directors from this beautiful institution led by Dr. Marco, co-founders Dr. William and Dr. Pennylaw, and the team that is led by the Dean, Dr. Kumalo, the University Council, Head of School of Health Sciences, Group CEO of Netcare, Dr. Friedland, and I'm glad that he's going to make that flight to wait for me, because we are on the same flight. The CEO of Siemens and all other CEOs representing various entities. I also wish to acknowledge all the stakeholders that are present here this evening, the group senior executives of various entities, also of Aspen, Dr. Stavros, the chief medical officers of Discoveries and all other entities, the media specialists, Mr. Jeremy Meggs, and all other distinguished ladies and gentlemen, the staff of this education institution. Good evening. Good evening, ladies and gentlemen. Okay, now I hear there's some people in the room. It is both a pleasure and an honor to be standing before you here in the celebration and the recognition of the work done by your institution. I hope that my presence here signals the commitment of the department to partnerships that will take the PSET sector forward. The negation of the private institutions, whether they offer medical care or education, stems from the notion that private means profit first before people. So it is your duty, and as the leadership of this institution, to help us dispel the notion by following every regulation, every guideline to the T, as provided by the department and the various acts. I'm excited, though, to learn that part of your policy of this institution will be including 100 students from the disadvantaged backgrounds to study in this institution. And let me tell you, you are the trailblazers, because we are already looking at this model in the amendments to the Education Act that is already in the go. And this amendment is really also shaped by what is happening in other countries in terms of the private education, particularly the private higher education. So we've looked at countries like Turkey and many other countries in terms of how are they working with the private higher education institutions. So you hold a great responsibility to be change makers as you embark on this new exciting journey that you are celebrating here today. Your actions and diligence in following the rules will help us inspire the youth, and that can sit responsibly at home as the student, and that can have a mark, and knowing that your institution can be an institution of choice for our young people. It is especially important that education provided in these institutions speaks to the goals that we are all aspiring to as a country, to move in forward and do so with the quality and care for the people that need the education most. And I must say that I was very distressed to hear one student this year who studied at Stadio, I think it's Stadio University or Stadio College, and they wanted to go to a public institution to further their education in the masters and the honors, and they were told that the public institutions do not recognize those qualifications. And I think this is one area that we have sought as the department to try and engage the institutions to ensure that there is synergy between our private and public institutions. The vision of the Department of Higher Education and Training has for the future of our education is that more blended learning needs to happen to bridge the gap, and it is to have, to ensure that there is improved access and the futuristic and skills-based approach to education. You would have seen from the matriculants that have passed in the previous year and the numbers that are coming to the higher education and training sector or system, and how we are responding as a PSET system in terms of those expectations. Obviously, there is still a lot of discussions that is going to be happening between our basic education and ourselves in the PSET system, so that, again, there is synergy between what the basic education say in terms of what they term as their passes, in terms of their diplomas, or in terms of their, students that needs to enter into the university institution. So it is important to acknowledge that while government is more than happy and willing to work with private institutions in the quest to improve education for all, compliance to the standards set by government will not be compromised. And in a rapidly changing world that we all know is fading in front of our eyes, and so for us who are in the decision-making positions, the posture that we hold for the desire of the future must be aligned with what we think will be good for the future of our country, for the future of our economy, but more importantly, for the future of our young people and where the country needs to be going to. South Africa has some of the best medical doctors in the world, and our researchers and research was lauded even during COVID-19 pandemic as being one of the best in the globe. That is something that we should celebrate and ensure that it is increased and guarded jealously through the improved of the education offered in various institutions. And we must always aim high wherever we are providing the education. And as a country, we carry a disproportionate burden of disease, communicable and non-communicable disease, exacerbated by poverty, malnutrition, unemployment, gender-based violence, and deep systemic inequalities. Climate change is also compounding these realities with the new forms of vulnerabilities. And therefore, it is important, as we celebrate the milestone that you are achieving here today, we put all of these issues in front of our view. The future of the health science cannot afford to be reductionist or narrow. It must be intersectional, decolonized, and context-sensitive and justice-centered. We need a research that goes beyond disease diagnosis, but one that dismantles the systemic that perpetuates them And those are some of the issues we'd like to see and interrogate. And my hope is that the students in this medical school bridge that chasm between the data and the dignity, between the publication and the lived realities and the experiences of our communities that they have to live with on the day-to-day basis. And when we look at the research, we should be able to understand who is it for and what is it for and what is it that it's trying to respond to. So as government, we are dedicated to improving the relationship and enhancing the linkages within the industry. And it is in all the effort to reduce the obstinate number of unemployed graduates. It is very important, ladies and gentlemen, that we do not shy away from the conversation of the public and private partnerships and how we are going to manage this kind of partnership. It is a conversation that we are having to have an honest as a sector, but also within the various disciplines. More than anything, it is also important that we can see the glaring fact that we need a multi-sectoral approach in a way we solve the South Africa's crisis and challenges, be in the education or in the healthcare. It is imperative that we approach this discussion honestly and be impassionate, because the task that lies ahead of us, whether we are in government or we are in the private sector, is to think beyond the confines of our own industries and sectors, but to put at the center of our discussion our people and the realities that we're facing as the country. The world has shown us more convergence in this era than ever before. So it is surely imperative that we approach each other with honesty and the desire to see this country better than it has ever been before. It will take all of us, all our efforts, all our innovations to make this happen. I had the pleasure of interacting with the education and the changes that are happening in countries such as China, Hungary, and many other countries. And it is exciting to see how technology improves education while striving for a just and equitable world, and the advantages that are made in the medicine specifically made me so excited to come back here in a few years' time, where we are going to be coming back to this institution and looking at graduates that will be coming out of here with that kind of experience and the innovations that are much needed by our country. We wish to pledge as the department to recognize and support the work that is being done by the private institution, such as this one of your institution. I think the doctor has actually spoken a lot about futuristic planning and what it is that we need to be looking at. In 2021, UNESCO published a report titled Reimagining Our Futures Together, a new social contract for education by the International Commission on the Futures of Education. The report asked three fundamental questions. One, what should we continue doing? Two, what should we abandon? Three, what needs to be done creatively and what can we imagine? And as we go to conquer some of these challenges, as we go to answer some of those questions, and in the future, we need to be able to put at the center of those answers our communities and our country. And I'm glad that when I heard, Dr. Speaking about the futuristic, issues that we need to be looking at, we attended a class, I think it was last year, where it was fascinating to hear how in the next actually 10 years, although it's already happening in other countries, we're going to be able to even choose how many years we want to live. Whether you want to live up to 100 years or up to 200 years, and that's how technology is even changing. And that's how we would like to see, even yourself with this institution, reimagining the sector and the programs that you are launching. So as you go ahead and conquering the future, we wish that many of those questions that are top of our mind are answered, but they're answered honestly and to ensure that our education received in the schools and in the medicine is transformative and is innovative, is collaborative, is inclusive, and the context is responsive and is renewed education that is just, that is equitable, that is accessible to as many of our children as can be. Thank you.
Can we do this? Dr. Numusa, without your support from the Department of Higher Education, this will continue to be a dream and a vision. And when you talk about private education being in profits, spending the evening with us today is indeed an honor, but you learn that we're beyond profits. We're about service to mankind. We're about disrupting private education by giving access to individuals that cannot afford premium private education through programs like Education for All and our Study All FinTech initiative. And this is really about revolutionizing and disrupting even ourselves and even our own profitability. And when I introduce our chairperson later, you'll understand where our journey all began, before academia and before business. But thank you again so much. And we look forward to engaging with you further, and we look forward to making this vision and dream into a reality with your support. Thank you. Our MEC for Health and Wellness sends her apology. Namantu Nkoma unfortunately couldn't be here, and so she has delegated her presence to Mr. Anele Apleni, the Chief Information Officer of the Gauteng Department of Health, to attend on her behalf. I think it's opportune that we have a CIO amidst us because we're talking about disrupting health with technology. So I'm really looking forward to, and I'm sure the rest of you as well, on how the Department of Health and Education are being disrupted with technology. Over to you, Mr. Anele.
Okay, thanks very much, and good evening. First of all, I would like to apologize for the MEC for the Gauteng Department of Health, that she's not able to join us this evening. Program Director, Leadership of Regenesis School of Healthcare and Science, distinguished guests, colleagues, partners in healthcare and academia, ladies and gentlemen, a special greetings to you, Honorable Deputy Minister. Good evening, and thank you very much for the opportunity to address you at this important launch. It is truly an honor to be part of this milestone event that speaks directly to the future of the healthcare leadership, innovation, and digital transformation. Unfortunately, the Honorable MEC, as I already said, for the Department of Health is unable to join us today due to other pressing government commitments, particularly the legislation issues where her presence is required and cannot be delegated. She sent her warm welcome, regards and apologies. As a result, I'm here on her behalf to convey her support on this important initiative. The topic for today's session, innovation and leadership in the healthcare, is extremely current and deeply relevant to the department and to the work that we do every day as the Department of Health. Innovation is no longer a concept of the future, it is a present day necessity. The use of smart technology and digital solution in the healthcare is no longer theoretical. It is a living reality that we must embrace. There is simply no way to avoid this route. It is like a road where you are forced to take a detour right to the left where the right-hand side is closed. You may not have planned to take this route, but you have no choice. You must move forward. That is the reality that we face as a Department of Health as far as the digital transformation is concerned. Digital transformation and technology-driven solutions are not optional. They are essential if we want to deliver quality, efficient, and patient-centered care. Let me take this opportunity, Program Director, just to illustrate this. I will just give you some few examples. Just yesterday, the Gauteng Premier, Panyaza Lesufi, in his State of the Province address, spoke about the innovation in our health facilities. He highlighted one of, amongst other things, the importance of the queue management system in our hospitals. I'm sure all of us who have experienced or else who have seen some of the articles that speaks to the queues in our hospitals. And this move is towards the digital filling systems, moving away from the traditional paper-based records. We all know the inconvenience and the frustration caused by the missing of the patient files. When a file is lost, a patient may have to repeat their history, undergo duplicate tests, or experience delays in treatment. It also places healthcare professionals under pressure, and it compromises clinical decision. It is an unfortunate situation that a such fire in Tembisa Hospital, which has affected administrative areas, the limitation of traditional incidences like this reinforce the importance of digital systems and proper records management. Queue management is another area where innovation has been long overdue. For many years, it was unacceptable that our grandparents and elderly citizens had to wake up at 5 o'clock in the morning and stand in long queues just to collect their medication. When the MEC assumed office, she was very clear: our facilities must begin to operate like banks. When a person enters, they must be attended immediately, assessed, directed to the correct service point, and be given a unique number. That is the vision that dignified, efficient, and responsive healthcare. Here we are sharing information on the progress we are making as a department. On the electronic digitization, we have successfully implemented a digital information system in several hospitals. That would include Chris Hani Baragwanath Hospital, Charlotte Maxeke Hospital, and Charlotte Maxeke Academic Hospital, with more facilities currently underway. The system are improving record management, reducing waiting times, and strengthening continuity of care. On queue management, we are using technology to reduce unnecessary waiting times to improve patient flow in our facilities. We are also piloting a forensic pathology management system, beginning obviously with Carltonville, and will soon open the Johannesburg Forensic Pathology Laboratory, which I wish I can invite you to, which will significantly reduce backlogs in the DNA testing and support criminal justice. Infrastructure improvements are equally important in servicing of our patient care. In the last financial year alone, we completed about 27 healthcare facilities and will refurbish projects prioritizing emergency units, theaters, maternity wards, clinics, and mental health facilities. Some of these projects include Jubilee District Hospital and Bethel Hospital. The combination of the infrastructure technology is very critical if you can build a modern, resilient healthcare system that we can meet the needs of our population. When it comes to smart and digital technologies, we must be honest. We have not yet arrived where we want to be. While this solution has not yet been fully implemented across the department, we are still on the journey. We are learning to build the capacity and preparing our systems and our people for this transformation. Digital technologies offer enormous potential in patient management, diagnostic, predictive and planning in the healthcare systems administration, and we are committed to explore these opportunities responsibly, ethically, and effectively. The presence of innovation in the healthcare is not just about technology. It is about improving the experience and the outcomes of our patients. It is about ensuring that every person who enters a healthcare facilities is treated with dignity, efficiency, and care. This launch is therefore very timelessly and very strategic for the department, training healthcare leaders who understand innovation, digital healthcare, smart technologies will strengthen our systems and ensure technology serves people, not the other way around. Once again, let me congratulate Regenesis for its visionary initiative. The future of healthcare lies in the innovation, collaboration, and courage to embrace the change. I thank you.
Ladies and gentlemen, thank you so much for being attentive through all our speakers. I'm sure you can't wait to have the debate begin on stage. I've been hanging at the edge of my seat, and I kept watching my time and trying to, at some points, fast forward so we can get to this moment of the debate. So if we could have our debaters, participants on stage, or are you going to introduce them first? Okay. So ladies and gentlemen, the man walking on stage is someone that has either been in our bedrooms when we've been tucked in bed and the TV is just above us, the lounge, the car, away on holiday. So he's been in every space of our home, right? And continued to entice us with exciting news, entertain us with very controversial topics. And so it is my pleasure to have someone today that's going to provoke discussion, navigate, incite complex ideas, and bring clarity to this debate. It's really an honor to have Jeremy Maggs associated with our school at Regenesis. His career spans a journalist, a broadcaster, communicator with decades of experience across television, radio, and public discourse. Jeremy, I'm going to hand over to you, and let's give him a resounding applause, ladies and gentlemen.
Just for the record, if Mrs. Maggs is listening, I've not been in anyone's bedroom apart from yours. Could I just get a little bit of help in pulling the podium back, if we could do that? That's brilliant. Ladies and gentlemen, the motion before the room tonight: South Africa can build a globally competitive, AI-ready, technologically advanced and equitable health system within the next decade. I am going to frame the debate for you, and the debate will last about 25 to 30 minutes. Once you've heard from those proposing and those opposing, you will see a QR code on the table. I will invite you to take your mobile phones to scan the QR code, and you'll be able to decide on who has won the debate tonight. Ladies and gentlemen, before I call our speakers up, let me just frame the way in which we're going to do it. The question that is before the panel members tonight is not whether reform is necessary. We all agree within the South African context that it is within this sector. That's exactly why Dr. Rowan and his team have stepped up to be part of that process. I think, though, the real question is whether South Africa has the structural capability, the regulatory agility, the financial muscle, the digital infrastructure, the data governance, and you've heard much about that this evening, as well as maturity and AI readiness to build that globally competitive, innovation-driven health system. Ladies and gentlemen, this is an adaptation of an Oxford-style debate. And let me say clearly and emphatically before we start, and this really is important, the views expressed tonight by my panel members do not represent those of the speakers or their organizations necessarily. And before they even come up, I want to thank those who are proposing and opposing for playing along with this. The idea behind this process tonight is to stimulate some debate. As Dr. Marco said to me a little earlier, a little bit of robust discussion. Never a bad thing within the South African context. The way in which we're going to do it, ladies and gentlemen, each participant will respond to a specific question. I will then move on to the next contributor, and I'm hoping that that will ensure a rigorous exploration of artificial intelligence, of innovation, of equity, and system readiness. So, first of all, ladies and gentlemen, I'm not going to read out CVs because I'm sure that you would rather me get to the substantive nature of the discussion itself. I would also ask the panel members to come up in the order in which they are called, and if you could just find your name tag on the desk to my left and to my right, if I could ask you to stand behind that. So ladies and gentlemen, first up, I'd like to call Dr. Stavros Nicolaou, Group Senior Executive Strategic Trade at Aspen Pharmacare. Stavros, if you'll join me on stage. You're right next to me here, sir. Then if I could then call Ayanda Swana, Siemens, Chief Executive Officer, Siemens Healthineers. Ayanda, thank you very much indeed. If you'll just take your place at the middle, there we go, at the end. And then joining you on your team is Dineo Leoma, who's Chief Executive Officer of Dr. Tella. Ladies and gentlemen, they are proposing the motion tonight, yes, we can build it. Opposing that motion, ladies and gentlemen, I'd like to call onto the stage Dr. Brad Biera. Brad, if you'll join us, please. And Brad, I think you're over there. If I could also ask Dr. Boitumelo Semeti Makokotela, Regulatory Integrity, Safety and System Readiness she'll be discussing. And she is the Chief Executive Officer of the South African Health Products Regulatory Authority. And then finally, ladies and gentlemen, Dr. Sylvia Sateghe, Chief Information Officer at the National Health Laboratory Service. Please feel free to sit down or stand up. There should be a mic on each of your tables. Dr. Stavros Nicolaou, let me come to you first in proposition of the motion. And again, just to remind you, ladies and gentlemen, South Africa can build a globally competitive, AI-ready, technologically advanced, and equitable health system within the next decade. Stavros, you argue that South Africa can build a pharmaceutical self-sufficiency in an AI-driven supply chain world. Let me ask you this. Can we genuinely compete with countries like India and China on cost, scale, and digital manufacturing capability? The floor is yours.
Thank you very much, Jeremy, and good evening to all the colleagues. I'll also respect all the protocols. The nexus here for me this evening has been very much around artificial intelligence and its application. And we've missed, as South Africa, the first, second, third, and fourth industrial revolutions. We've missed all of those. And we cannot catch up. The wonderful thing about AI and digitalization is that we can now leapfrog. Because you don't need to go and build factories and backwardly integrate, etc. You're in a unique position if you have the acumen and the prowess, and above all, the entrepreneurial flair to do the leapfrogging. How are we going to build a globally competitive pharmaceutical industry when we are lagging so significantly at the moment? The key here for me is how do we, the Honorable Deputy Minister was saying that we have the most disproportionate disease burden of just about any country in the world. That means we should have per capita the most volume consumption. It's like saying you have the biggest car industry, but you're importing all your cars. So what is it that we need to do? What's going to move the needle? We need to leverage our local volumes and capacities to build competitive world-class manufacture, accelerated and given momentum by the application of AI in the manufacturing processes and in the regulatory pathways. And there, I'm sure Dr. Samete will come in as well, and I'm sure she can't disagree with me that AI can only work to build a world-class pharma industry in our country. Thank you.
Stavros, thank you very much indeed. Dr. Botumelo, let me ask you then if you would like to respond to that. I'm very happy to allow that. But the question that I want to put to you is regulatory caution the safeguard then that protects patients in this fast-moving AI era, or is it the brake? Is it the brake that slows down innovation unnecessarily?
Thank you very much for having me here. So it's quite difficult for me to sit on this side because I am fully convinced of the benefits of AI. But I think it's good that you do it this way because I think we need to stretch ourselves and not get caught in the excitement of what this can present. I think there's certainly a cautionary approach that we need to take. And I always start with the basis of saying, do we have the right data sets to feed into these models? We're piloting AI at the moment at SAPRA, and we're struggling because of the quality or the poor quality of data. Many of us know that on the continent, we do suffer from not having adequate data. So as we are intentional and have these grand plans around AI, let's make sure we have the right foundation in terms of patient data. Because if we do not, we're going to end up using models that are developed using other people's data and therefore not giving us the type of insights that we would want to have. Secondly, you want to utilize models that you can validate. For me as a regulator, I look at statistical factors. I look at, is the model sensitive enough? Is the model going to give me the right data when it is the right answer? So sensitivity, specificity, and accuracy and consistency of the model becomes critical. But you can't get that without the right data sets. And so from my position is we have to be cautionary and manage the excitement. And lastly, we have to look at risk-based approaches. And I'll make an important example, not AI related, but demonstrates the power of such tools. For those of you in the diagnostic industry, you know that when you develop your test, you look at its sensitivity and specificity. One thing we looked at during COVID was the test must tell you you're positive when you're positive. It mustn't say you're negative when you're positive, because the impact of that is dire. So those parameters become quite critical. So a risk-based approach becomes important to how we think about AI. Yeah, very tough question, but that's my cautionary view.
Thank you very much indeed. I've just noticed that I'm on the stage here and I've chaired many debates in my career, never with so many doctors on a stage and in the audience. I feel medically very safe tonight. Ayanda, if I could bring you into the debate, please feel free to tear that argument apart if you want to, but let me put your question to you. Do you believe that artificial intelligence is the great equalizer that is going to democratize healthcare access, as we've heard our previous speakers allude to, or do you believe it is going to widen the digital divide between urban and rural South Africa?
Thank you, Jeremy, and good evening, everybody. I think from the discussions, the comments that have been made so far on regulation, I think the first point I would say is regulatory caution is important because it safeguards patients. But also we have to accept that regulatory paralysis is equally futile. So governance cannot lag behind innovation. At the same time, we cannot allow a situation where innovation is progressing and governance is not catching up. It's really important. Now, back to the topic about whether AI would be a great equalizer. I fully agree with that. And I think this is not a maybe, it's something that we must do. Imagine, for example, Jeremy, a rural clinic anywhere in the country, because this geographical divide has got this element that most people say where you live should not determine if you live. So it's quite important that we bring in these technologies, because what they do, they actually help to bring this, to actually almost abolish this divide, because all of a sudden, a rural clinic, whether it is in the Eastern Cape or wherever, has access to a specialist. I'm not saying we don't have connectivity problems and stuff like that, but if you look at the financial sector, for example, we've been able to become world class, whether it's banking or whatever. And we know that in this country, digital, the mobile adoption is more than 90%. So we know that it is possible. We've seen it in the finance sector, and I strongly believe that in healthcare, it is equally doable. And also, the more we do it, the more we'll close this gap. Yes, acknowledging at the same time that we do have challenges like digital literacy, but that should not stop us and create inactivity. We just need leadership. Thank you.
Anda, thank you very much indeed. Brad, if I can come to you, there was a famous movie once that said, show me the money. You all know the movie that I'm referring to. So leading on from that whole issue of funding sometimes not being equitable, I'm wondering whether any health system can be equitable or even AI ready if funding pools remain fragmented and fiscally constrained, which you will concede is a reality that exists not only in this country, but in many developing economies. The floor is yours.
Thank you. Hi. By way of taking the contrarian oppositional view of my colleagues, can you just look at each other for a minute? Not too long, but just have a look at each other. And you'll notice you're all different. You're different ages, races, demographics, sizes, physical attributes. You also have different income ranges, but you're probably all in the LSM 8, 9, and 10, which means you're rich. Who doesn't have a device with them today in the room, other than me? No, I don't have a device, any device, your mobile device. And the reason that I'm saying...
What's on your finger there?
Well, this is a wearable device, so fair enough, I have a wearable device. Who's got a communication device? Does everyone have a communication device? So, shaming me is good, and it illustrates the point that I'm trying to make. Many of us...
Glad I could help. Yeah.
Thank you for helping. And while you're out of other people's bedrooms and we have this conversation, the reality is our social conditioning limits us in certain ways. So we have currently only a 41% employment rate of employable people. That's 13 million out of 60, of which 5 million work in the informal and agricultural sectors. There's an issue of affordability. There's just not as much money as there is month. And to my colleagues on the other side, you speak about bandwidth, and you speak about employability, and you speak about the desire for regulation. We simply don't have a tax base that can afford this, number one. And number two is we don't have a contribution base. So even if we did have a tax base, the kind of cost that it takes, and you heard our speaker earlier talk about the 700% increase, the likelihood of affordability of the device plus the bandwidth, plus the contribution, plus the demand-driven care, because currently it's supply-driven. It's unlikely over the next fiscal period of 10 years, which is very short, that we'll be able to afford the kind of fully integrated, fully accessible, illiterate health that we're aspiring to.
Thank you very much indeed. Just by show of hands, who has got wearable device? It'd be very interesting to see. Just, there you go. Most people in the room. Isn't that interesting? Even me. Even you, yeah. Dineo, you are a med tech innovator. Let me ask you this question, if I may. Do you believe that telehealth and AI-assisted diagnostics realistically close rural access gaps, or do you think, as it's been alluded to already, basic connectivity is still the biggest or the bigger constraint?
That's a very good question, and also just a disclaimer, I am actually for the use of AI in diagnostics, especially in lower LSM groups, because this is the lived reality that we have to deal with on a daily basis with the work that we do. So, to your point around access to mobile phones, again, if you are sitting in this room and you have access to a medical aid, you are actually part of the elite. There is 84% of South Africans that don't afford medical aid, and that obviously impacts in health outcomes. So to your question around the use of diagnostics and AI in the rural context, I really think that this is where we can make an impact. There are technologies, some of which we are also implementing, where you can actually chat to a doctor or a nurse using virtual healthcare. And we're actually also pushing the boundary a bit further. In the months to come, we also want to introduce AI-assisted healthcare, where you won't necessarily be speaking to a doctor, but when we can flag that there's a need to basically introduce a doctor into the conversation, we're able to pull that into the conversation. So what that essentially does is that it will lower the cost to access to healthcare. So if you are experiencing a chest pain, the AI will be able to triage and say, actually, speaking to an AI assistant is not enough. Let's rope you in and speak to a doctor to get further assistance. And what that essentially does is that it lowers the barrier for access to healthcare, especially in this LSM group, which we all know that has been a real disservice has been done just to people who can't afford medical aid in the lower LSM groups, who heavily rely on public health. So yes, the answer is it can be used. There are actually technologies, some of which we also have, where just using your mobile phone, you're able to take your temperature, blood pressure. It can also pick up how stressed you are and basically give you a wellness score. This information, which doctors can essentially use to be able to give a more concise doctor's consultation and clinical outcome. What we also do then is then remove the access to, the friction of access to data, because we know that mobile data is actually quite expensive, and give zero-rated services, which we've seen has made actually makes a massive impact as to whether a person does access a doctor or not. So the answer is definitely yes. We've got a 96% mobile phone penetration in South Africa, which is actually one of the highest. There is definitely an opportunity to be able to merge access to healthcare, AI, and mobile phones to have better clinical outcomes.
Dineo, thank you very much indeed. May I just say for the record that if I'm experiencing chest pains up here right now, the hell I'm going to ChatGPT. I've got assistance. I've got assistance on the stage with me. Dr. Stavros, back to you. Let's talk about regulation, if we can. Regulatory delays, or let me put it this way, do you think that regulatory delays and approval bottlenecks, such as we experience in this country right now, is undermining innovation within your industry and, as a result, AI-enabled manufacturing expansion?
Jeremy, the starting point for me is, despite all the progress that we've made, only 30% of the diseases known to mankind are curable at this point in time. So that means we're sitting with 70% that we cannot cure, and in many instances cannot even manage. Some of these are incredibly debilitating. I can talk about the motor neuron diseases, the MSs, I can rattle off the list. Now, the benefit of AI in firstly accelerating regulatory pathways, secondly, assisting with the design of new drugs and new molecules or tweaking existing molecules, and thirdly, speeding up clinical trials is a massive advantage and will assist us to close the gap, that 70% gap that I spoke about. Now, what do I mean by this exactly? It takes around 10 to 15 years to discover a new molecule at a paltry cost of between 2 to 3 billion US dollars. That means that is more than most, the market cap of most listed companies on the JSE in our country. The aspect of shortening regulatory pathways by, for example, reducing the timelines for clinical trials, making the biostats more efficient, identifying patients that take you months or years to identify for clinical trials, you can do this in a matter of weeks now, is of significant benefit to society. But here's the big sweetener for me, Jeremy, and that is all well and good having all these wonder drugs that we are seeing today, and we're seeing many of them. It's the first time AI and classic R&D are colliding, and that collision is giving us a fantastic pipeline of products. The problem is here in our country, we cannot access these drugs, unfortunately. So speeding up all of these processes, including the biostats and the clinical trials, means that the innovators can better optimize their patent life cycles, which is inevitably, I think, going to improve access to treatment, particularly for countries like ours, where you've got these vast swathes of inequality. So I think this is yet another demonstration why AI, particularly in a South African setting, can make such a significant difference. And that is why, and I'm not picking on my colleague, Dr. Samete, she said SAPRA is presently testing AI. And SAPRA, through no fault of herself or her staff, cannot deal with the capacity that is being thrown worldwide to us right now. AI is the perfect answer.
Stavros, thank you very much indeed. And Dr. Sateki, I hadn't gone out of order. I wanted to go back to Stavros so I could give you something to punch back on. Okay. And I have absolutely no doubt that you're going to do that. So in reply perhaps to what he was saying, do you believe that we're maybe designing an AI-enabled future health system without first stabilizing those operational bottlenecks to which we have referred?
Thank you for that question. I would just say I'm in technology, therefore I believe in AI myself. However, we also need to take things step by step so that we don't implement things that will come to bite us at the end. I think when it comes to health, it's not about speed, it's about precision, and therefore that clinical validation becomes very important before we jump and we run with the hype of AI. I think my colleagues mentioned that we missed the first, the second, and the third industrial revolution, and we now want to jump into AI. We are grappling with electricity issues, data center. These things are energy intensive. Perhaps we need to fix the basic infrastructure first and get things right, especially in the next 10 years. Yes, we are for these things, but we also need to get things right. So when it comes to what do we need to do and the regulatory part of it, and especially because we will be dealing with people's data or patients' data, the importance of us having governance and being risk-based it remains. So we cannot just leapfrog into how things are done because it's such a hype to do it. And for me, yes, while AI would help with, you know, your volumes, we still require the real intelligence, not the artificial intelligence, the real intelligence in the value that we see in the data. And I think artificial intelligence will, as much as it can help us with so many other things, but we should look at it at saying that it will deal with volumes and maybe guide us to where we need to come and focus as human and still apply our human judgment based on the inference that we got from the artificial intelligence. Thanks.
Thank you very much indeed. I want to pivot now from regulation into technological preparedness, Ayanda, if we can go there. And do you believe that we are sufficiently prepared in this country for this giant step that in one way or another so many speakers have referred to tonight? We still do have electricity instability in South Africa in spite of the best efforts by Eskom. We have connectivity gaps. We've spoken about that. We have poor data integration. To what extent is all of this holding us back as we chase this, this medical nirvana?
Yes, it is holding us back a little bit. However, there are pockets that we are seeing, whether it is in the private sector, in some cases also in the public sector, of really great progress. Even the telemedicine we were talking about, we saw a massive acceleration during COVID pandemic. So I would not subscribe to the idea that we are not ready. Firstly, we have great entrepreneurs in this country and innovators. So they should be allowed to innovate. And then obviously the regulators are enablers. Then where I see is that then when it comes to the private sector, this is where you start to see the small pilots. And then the main part for the public sector is actually to then scale this up. And then, because these things are already in place, and we've got very strong universities to validate these exercises. And then also the regulator is there to do also post-market surveillance. Yeah. So I think the country is very strong, and we can definitely deliver, personally I believe, in the next 10 years.
Thank you very much indeed. Brad, let's move from tech now to a favorite topic in this room, and that's NHI. Do you think that the National Health Insurance proposal is going to accelerate in one way or another AI-enabled reform, or do you think, as many have suggested, it will introduce fiscal uncertainty that maybe deters progress and investment?
Jeremy, thank you. I think NHI is a beautiful topic to talk about. But if we're talking about national health insurance, at the top of the rung, let's work it down to where this starts. So we go back to the white paper on the changes of healthcare from 1984 to the at least 30 different policies and legislations that happened in the 25 years since then. All of those have led to three fundamental principles. The first is we need to improve access to care for the majority of people who are underserviced. And underserviced is anyone in a peri-urban or rural area, and often in a rural area without access to care. The second piece to that is to define what does care mean. So when we start looking at care, what's preventive care, primary care, interventive care, rehabilitative care, and palliative care, and what does that include? So it includes the devices, and there's only items 8. But equally with that, there's then the access to the appropriate medicines, the appropriate care, the appropriate facility at the appropriate time. So bearing all of that in mind, the journey of identifying who are the right providers in which area at an urban, peri-urban and rural setting is important. And then we've got to recognize that we're in a low, medium income country. So from an OECD perspective and others, the affordability of care is massively disproportionate. So what's the view of NHI in its ideal form? Is everyone has affordable care that's accessible in real time for what they need. Are we there yet? Not by a long shot. So back in 2001 to 2005, we started doing the Risk Equalization Fund to say what's happening in private medical schemes and what do we need in the public sector to fund this in order to make that happen. We are probably 15 years away from truly understanding what that contribution, what the risk pooling, what the epidemiology, for those of you, that's who does what and where with which pieces. And then finally with NHI, the important piece is this issue of algorithmic bias and information asymmetry. So I asked you to look at each other and say, what do you look like? And you notice you're all different. We currently rely on what's called weird data, Jeremy. And that's not me being unusual. It's Western, educated, industrialized, rich, democratic data around health, around disease, and around the funding of disease. So our departments, and it's not only the Department of Health, but it's education, it's treasury, it's finance, it's infrastructure, all need to come together on a consolidated budget to then decide where that money's coming from.
Dineo, have a stab at this question, if you would. If forced to choose, do you think that we should be scaling health or digital health solutions quickly with imperfection, or perfect them slowly within compliance networks?
Jeremy, in the context of healthcare, it's always good to err on the side of caution. So I would actually argue for the latter, where we need to scale carefully. And I think a typical example is, which we can learn from going forward, is what happened with a company called Theranos. If some of you don't know, where it was a fake it till you make it. They pretended to have this magical device where you can test, I don't know, hundreds of diseases from one drop of blood, only to figure out that the device doesn't work. And unfortunately, a lot of people who were sick relied on that technology to give them some sort of decision-making power. So to answer your question, I think it's important for us to scale carefully, but also scale intentionally. Partner with regulatory bodies such as SAPRA that also enable innovators to test these technologies in a safe space. You know, with the clinical trials and in a controlled group, so that when we do get the validation, it's good to go. But I do believe that it has to be in a controlled format, but also supported to basically bolster the rate at which the approvals do take place.
So, Boitumelo, let's move on from that then. In this age of hyper-accentuated machine learning and predictive diagnostics, what do you think is the greater risk? Moving too slowly or moving too quickly?
I think it's moving too quickly, and I must agree with Dineo, and I know we're supposed to not agree, but
It's fine.
I must agree with her.
At this stage of the evening, we're all friends.
We're all friends now. Okay, great. I fully agree with her, because as we all sit here, we're all well-intended, right? We all want to comply with governance standards. We're professionals, but there are those who are not well-intended and could utilize the data for ill gains. So we must be cautious on that. And that's why regulating such tools becomes of importance. But also I think for us to get any significant gains, even though we move cautiously, we need to think about working together differently. if you want to succeed with AI, you're going to have to think about employing people that don't look like you, sound like you, say what you say. We're seeing that in our space. You're going to have to partner with those that you typically wouldn't think about. You're going to have to go into those spaces that you typically would not consider going into. You're going to have to make sure you've got the right set of data for the African population to eliminate bias. And that requires that we think differently about how we work. And that's why the School of Health Sciences that was spoken to earlier, and I must commend the team in that what I'm seeing is you saying we've got the basics of medical science. Let's integrate this with other tools, with other solutions, with other skill sets to start addressing the core problems of this country. And it needs to be a holistic solution. And I think AI needs a holistic approach.
The proposing team has had 2 questions each. Finally, Dr. Setegi, I'm going to give the last question to you before we put this to an audience vote. And let me try and generalize it if I can. In 10 years' time, when I won't be visiting anyone's bedroom, will public diagnostics and AI capability, in your opinion, match private sector sophistication, or do you think the divide will become inextricably wider?
I think it will match it, and I think public sector diagnostic currently is doing well. I think as Dineo was explaining, 84% of our population don't have medical aids, and they really depend on the public sector for diagnostic. I mean, NHLS, we hold that data. So, and we're doing so well such that even some private patients are also coming through to us. So I've got no doubt that in the public sector, we are doing right. And perhaps maybe just to mention that we are also the ones that are training for the private sector. The private sector actually comes to the public sector to pouch our people who are very good at what they do to go and work in the private sector. So I've got no doubt that we are fine. But perhaps maybe just as a way of saying what needs to happen, maybe to accelerate that 10 years to be 10 months perhaps. We need to work on making sure that we are not manual so that we can benefit from AI. And AI being a benefit of a digitally transformed system, we need to make sure that we first digitize our manual data. Mr. Apeleni was talking about the long queues, the yellow files that you fill in. You can't go AI when we are like that. We need to first digitize. Once we've digitized, then we need to digitalize so that we can get insights out of the digital data that we have. And in the benefit of the digital transformation, then we will benefit from the artificial intelligence. But having said that, the idea is not for machines to decide for us or for machines to be the ones that are giving the diagnostic, but just for us to be able to narrow down into what we need and still apply our professional judgment. Thanks.
To both teams, thank you very much indeed. In the short space of time allocated, we've covered a vast swathe of topics, and my thanks to all of you. Let me just say one more time that this, or the views expressed by the panel members tonight, do not represent those of the speakers' organizations or them individually. Thank you for stimulating some thought for us. We really appreciate it. Ladies and gentlemen, before I hand back to Indrani, let me just explain, if you would like to participate, you've heard views from both sides. On your tables, there should be a QR code. I'm correct? People have been voting, and we have a result. Good Lord, that was quick. Okay. So, who do you think won today's debate? I see votes are still coming in. This is terribly exciting. We should have this on a big screen somewhere. We really should. It is, I know, and that dates you, Stavros, it really does. Ladies and gentlemen, I'm going to call it at this point. Who do you think won today's debate? Team for, 20 points. Team against, 22 points.
Yay, Team U.
And there are always those in the room, aren't there, that want to sit on the fence, okay? 19 votes, they were both good.
Well done, guys. Well done, team.
Ladies and gentlemen, thank you very much indeed. Teams, to both of you again, I really do appreciate it, and a lot of food for thought. Indrani, I'm going to hand back to you, and thank you so much, ladies and gentlemen.
So Jeremy, I must say this was my first debate I went to, and I used to do lots of debates growing up. But the first debate where I had the opposing team agreeing. I know. And I think that was also part of the weird acronym, right? So let's give them a round of applause for their time, for their contributions, for stimulating such amazing discussion. I think it was very thought-provoking when you sit there and listen to what's happening just in the landscape of South Africa, and wondering, when we talk AI and listening to, first we need to digitize before we get digital, before we can actually have effect on AI, just how far in the race are we really globally? And this is where education institutes play an important role. Because if we leave it to healthcare or any institution, right? If you leave it to any institution to get AI, I'm going to use the word loosely, AI compliant, it's not good enough. This is where education really becomes the quantum leaper for the healthcare division. Because typically doctors will be focused on patient care and not digitizing patient care and not typically utilizing. So I loved what the doctor earlier said as well. We should be aware that the people that we're going to interact with are not who we are and who we used to. So you're not talking the same language anymore. Literally, you're bringing in the binary code into healthcare. So ladies and gentlemen, we're almost at that point where you're going to get into networking and over dinner and meeting the minds in the room that really want to shift gear and quantum leap in a new way of healthcare in South Africa, and to expand that into Africa and globally. We just have our keynote speaker now, and I want you to be prepared for this. So adjust your seat a bit. Just adjust, shift. I want to see you shift in your seat. Shift yourself. If I don't see you shifting, I'm going to point you out, right? I didn't see this table here shifting, Ashlyn. So I wanted you to shift, because in order to receive the message from this individual, you've really got to shift your mindset. So you have to be prepared to be inspired by a man whose life is a remarkable journey of courage, boldness, service to mankind, vision, and transformation. Dr. Marco Shadavanya is the founder and chairperson of Regenesis Education. He arrived in Africa in his mid-20s, clad in saffron orange robes as a monk, dedicating himself to the poorest of poor in Orange Farm, where he spent 7 years of his life. He built a primary school and a clinic, now Regenesis' flagship healthcare development project, headed up by Dr. Rowan Govender. Dr. Marco is really a maverick and a serial entrepreneur, business that goes beyond education in travel, hospitality, talent management, wealth and investment, trading on the stock market. And so he, beyond being an entrepreneur, a visionary, a philanthropist, as I've described him, an author, he's also a fearless adventurer. He has climbed and summited Kilimanjaro, skydived, flown helicopters, and explored over 90 countries. He's also been a finalist in the 2009 Ernst & Young World Entrepreneurship Awards. And he has transformed education, business, and society across Africa, India, and Europe, helping thousands unlock their true potential through holistic education. Ladies and gentlemen, please put your hands together for the extraordinary Dr. Marco Shadavanya.
Thank you. Thank you, Indrani. This is such a introduction, makes me really superhuman and very difficult to say anything now after this introduction. Tonight is a very special evening. It's a launch of this School of Health Sciences. It's something that is going to impact lives of millions of people in the next few years, next 10 years, 20, 50, 100, maybe 200-300 years, beyond our lives. So I want to thank you for being with us tonight here at this very special occasion. It is a very, very special occasion. I want to thank you for your time. I know you had many other choices. Jeremy being in the bedrooms and watching TV and eating food and all of this. So I want to thank you for your trust and for being part of this dream. It is a beautiful dream. It's a dream of making the world a better place. It's a dream of reducing suffering, because there is so much suffering in this world. It's a dream of increasing happiness. It's a dream of democratizing education. One of the things at the James that Indrani mentioned earlier, we have an initiative called Study All, where we allow financially disadvantaged students to access education on a model study now, pay later. Study now, pay later. So at the James, what we're really trying to do is to really democratize education. Because we believe education is a human right. It should not be privileged to those who have money. And we believe we can do this by using technology. Education and internet are two greatest equalizers in the world. Now AI has become. So that's really what we are trying to do. Our slogan is awakening potential. We believe that every human being has a divine potential. There's a power in each one of us. Everything we need to achieve our dreams is within us. We believe that each one of us is very special, very unique, 1 out of 8 billion people. We believe we are born on this planet Earth, not just to eat, sleep, and procreate and die. We believe to do great things, to make the world a better place, to reduce suffering, and to increase happiness. And we have a responsibility to do this. Education, we believe, is the most powerful way of empowering people and helping people achieve their dreams. So thank you again so much for your time. We cannot do this alone. We can do this together. So I hope you're going to participate in different ways in this beautiful, beautiful dream. We really want to build the best, nothing but the best school of health sciences, where best education is going to provide, best learning, latest, cutting edge, AI-driven. Not only where we will develop health professionals who are intellectually smart and who have the best skills and knowledge, but health professionals with emotional intelligence and spiritual intelligence. And we believe these two intelligences are superior intelligences. Emotional intelligence is intelligence of love and care and kindness and compassion. Ability to manage your own emotions and emotions of other people. And spiritual intelligence, I believe, is the highest form of intelligence, which we apply at the Genesis, and we teach all our students. Spiritual intelligence is intelligence of purpose, intelligence of knowing why we are born, understanding what's the meaning of life, why we are here on this planet Earth, and living our life true to our purpose. It's intelligence of ethics, of morality, of authenticity, of truth. So we want to produce health professionals who are conscious leaders, not just health professionals who are driven by money and self-interest, because that's a problem we have today in the world. We have leaders who are driven by greed, selfishness, and ego. That's why we have this problem today. And the problem is that most of these Ivy League universities in the world produce leaders which are driven by greed, ego, and selfishness. And that's why we have these problems. So we need more conscious leaders. So that's what we are going to do at the Genesis. And that's what we are doing. Developing conscious leaders who will create ripple effects in their families, companies, societies, in the world. And that way we'll fulfill our own purpose of being born on this planet Earth. So I want to thank you again, for being part of this beautiful dream, and for trusting your own lives and your own organizations. And so for me, inspiring and emotional to see all these big brands and big people, from Discovery to Aspen and Netcare and government officials and all of you, each one of you. So I want to really thank you from the depth of my heart for being part of this beautiful dream. I wish you good luck and God bless all of you. Thank you.
Thank you, Dr. Marco. And usually at an event or a pageant, you must have that pretty face that comes up and gives all the gifts. You know the one I'm talking about, right? So this event, we used Dr. William Vivian. He was the one that was coming up and let's give him a round of applause as one of our co-founders. And so it's very interesting because Dr. William Vivian also started his career out in healthcare and medical sciences, and that's his first degree, first master's before going on into his academic master's. And so it seems, Dr. William, that we've come full circle with healthcare in the shareholders table as well. Thank you everyone for participating. I would not do justice if I did not extend my sincere gratitude to our valued sponsors that's around us today as well. So Netcare, one of South Africa's leading private healthcare providers. Let's give a round of applause to Netcare. We're also going to use this time to wake up for the food, right? So each time you're going to clap louder and louder. Access Bank, a Pan-African financial services institution. We heard your cheer there, Dr. Ria, for African Bank. For Access Bank, huh? I went to the wrong one. Koi Health, a healthcare solutions provider. Koi Health. Where's Koi Health? Koi Health is right here. Siemens. This one is a... Yeah. So I see what they've done here. They've combined health sector and engineers, right? Siemens Healthineers. I've never had that one before, guys. A global leader in medical technology and diagnostics. Then we have Alchemy Health Technologies, an innovator in digital health and healthcare systems. Alchemy, Rowan is pointing me out to the back. South African Medical Association, the professional body representing medical practitioners who are going to support us with their medical practitioners in Orange Farm. I've just been speaking to them. Abbey Healthcare, those were those tech-savvy guys where you had to stand on it and it could do all your vitals when you arrived. So thank you, Abbey. Your partnership and generous support have been instrumental in making the launch of our School of Health a huge success. So thank you all sponsors. Last but not least, Sewela Wines. Thank you so much for providing a relaxing, entertaining environment while we network. So a round of applause to Sewela Wines as well. Once again, thank you to Dr. Rowan and your team, Dean Sibo Khumalo, for leading this launch of health. Thank you to our shareholders for your presence here today and all the professionals in health and support for being here with us tonight. We celebrate you and we thank you for your partnership and your commitment to see us through this journey. Thank you so much. Please, I welcome you on behalf of all the sponsors here. Go onto their stands, interact with them while you're getting your food. So we'll ask the first two tables to proceed towards the food. And whilst the first two tables are going towards the buffet, I'm going to ask everyone else to take turns to go around the room, make your way to the buffet as well. Please enjoy your evening with us and enjoy your networking session as well. Thank you, everyone. Ladies and gentlemen, we're going to be entertained by Clive on the saxophone in the back. Let's give Clive a round of applause as well. Thank you, Clive.